Okay, great. Thank you, and good afternoon, everybody, and thanks for spending some time with us today. I hope everyone's having a great day so far. We're back to share our regional data with you. As you'll see here in a minute, we continue to see some elevation in our numbers across the region, which is something that we're concerned about, and I think something that we need to address and as well as pay close attention to. And it's really a reminder to all of us that the virus is still out there and that we must do our part to keep it from spreading and to keep cases from increasing at a rapid rate. One way we can do that is by wearing a face mask, and that's something that we've talked a lot about lately, and we'll talk more about today after we go through today's data. And then after that, we'll take some questions from the media. So these slides are familiar to people that have been with us since we began doing this in April. So here's the chart showing our hospital admissions, and we're starting to see a small uptick in this number, as you can see from the graph. And again, it shows the trend in daily new hospital admissions since early April. So today we're reporting 22 new COVID admissions, which is down from yesterday, but still our rolling average is around 18. As I've mentioned many times before, we follow the trends and not necessarily the day-to-day fluctuations. And you can see from our trend line that it does have a slight tick up, and so this gives us a little bit of pause. So just to put this into perspective, we were as low as 14 about 2 weeks ago, and so as you can see, we're certainly above where we were just here recently. And we'd really like that number to go down and stay as low as possible. We know it won't ever get to zero until we have a vaccine, but still we like to see it staying low. Following that is our hospital admissions data, and so that's starting to see a slight increase as well. So this is our daily hospital census of COVID positive patients, and you'll remember that we changed the way that we show this data to reflect only COVID positive patients. And today our overall hospital census increased from 154 today. From yesterday we had 143 confirmed positive patients. And again, our rolling average today, represented by the blue line, as on our other slide, it's average of the past 7 days. And today it's 139, which is up from 137 yesterday. And again, always concerning when we see that rolling average creeping up. We'd like to see it stay low and get as low as we can. Now let me show you the daily hospitalization numbers. So again, these are COVID positive patients only. So as you can see on the screen there, we have 154 hospitalizations today of confirmed COVID positive patients. We have 40 in our intensive care units, and we have 23 confirmed COVID patients on our ventilators. Now these numbers have all either increased or stayed the same since yesterday. Now we'll take a look at our presumed COVID or suspected COVID patients. We have 93 in our hospitals today. We have 11 suspected COVID patients in our intensive care units and 4 on ventilators. And just as our other numbers, these have all either increased or stayed the same since yesterday. So again, it's a concerning data. Moving on to our good news slide. So yesterday the task force healthcare systems discharged 14 patients, bringing our cumulative total to 2,905. And again, a shout out to all of our healthcare workers who have made this possible by providing excellent care to all of those patients. So moving away now from our data and to talk a little bit about what I'm sure has been a really busy day regarding the mask issues. First, I want to recognize the progress that this region has made. We've come really a long way, and our numbers have dropped significantly since we first started this back in April. But that recent spike in cases across the region is concerning, and the increase in hospitalizations is concerning. And we don't want to go backwards. We want to continue to move forward with our reopening plans, and in order to do that, we all have to do our part. Which brings us up to the issue of today, which is the issue of mask wearing. So as most of you know, just a short time ago, St. Louis County and St. Louis City announced a new public health order requiring individuals to wear a face mask or a covering at all times when inside buildings or outside. when social distancing isn't possible. Now, there's really clear and convincing evidence that wearing a face mask or covering can decrease the risk of transmission of COVID. Multiple studies have shown that this simple yet effective measure can slow the spread of COVID-19. However, it also only works if the majority of people are doing it. And as you can see from this graphic, the more people that wear them, the less risk there is with being around each other. And so this is a very simple cartoon from the New Jersey Department of Health that shows the highest risk is if nobody wears a mask, and of course the lowest risk is if everybody wears one. And as I said before, there's a lot of good science out there that supports that notion that if the majority of people in the community wear a mask, you can effectively reduce the transmission or the transmission rate that we've talked about before to below 1. And so again, it's a very low barrier tool that we can use to really impact the transmission of virus in the community. So a couple of things about types of mask coverings. So there was a study that came out actually today that showed the different types of mask material that can be used to prevent aerosols and droplets from getting into the atmosphere, either from coughing, sneezing, or even just talking. And there's a fair amount of science out there as well about what types of materials are best for face coverings. This slide we took from the University of Nebraska, which is it's a very they have a biocontainment center, and so they do a lot of study on things like influenza and other types of contagious diseases. And so as you can see, you can use simple materials at home to make a mask, or as everybody knows, they're available out on the market as well. I would, though, say that I would refrain from buying surgical masks or N95 masks because we'd like to save those for the healthcare market. And a lot of these masks, if made from the right material and constructed properly, can be equally effective at even preventing infection as well as preventing people from aerosolizing or letting droplets come out. And so that's important as well as knowing what type of material to use. And we'll be talking more about that later in the week, I'm sure. The last couple of slides I wanted to talk about are who is wearing a mask. And so this is data from Goldman Sachs study, the financial institution Goldman Sachs, that just came out today as well. And it shows the proportion of people in the different states that are wearing masks. And as you can see, Missouri is right at around 40–50%. But the main takeaway from that study was the more people that wear masks, the less economic damage there is. And by that, they're saying if less people wear a mask and there's more spread, there's more cases, then you have to take dramatic actions, such as shutting down businesses and slowing down the economy. And so from economic sense, it also makes sense to wear face masks. And so that was the main point of this article. But this cartoon was just merely a reflection of what states are doing right now as far as mask wearing goes. So to wrap things up, we're going to keep a really close eye on this data, particularly as we make decisions going forward. We want again to remind you that as you gather with your friends and with your family for this 4th of July weekend, please be safe. Practice all of that social distancing, wear your mask, continue to wash your hands, do all of those things that we've been advocating for really since the beginning of the pandemic. So we don't want to undo all of the hard work that we've done over these last 3 or 4 months. We've made tremendous progress. We have begun to reopen the economy. We want to keep it open. We want to be able to progress. But in order to do that, the community really has to do their part. And part of that is to wear a mask out in public. So with that, I'd be happy to address some of the questions that we've received from the media.
As you've shown us over the past several days, we've seen an increase in our data. How concerned are you that this trend will continue, and will wearing face masks help turn this around?
Yeah, it's a good question. So we're always concerned when the data is going up, either from cases or from hospitalizations. Where we go from here is a difficult question to answer. As we've said before, hospitalizations are a lagging metric, so it's the end result of viral transmission that's occurred in the community. So if we can interrupt transmission or lower transmission in the community, then the result will be the hospitalizations will go down. It's difficult to forecast now, though, which direction we're going to go. But it also takes time to turn those curves. So if you think about transmission occurs in the community, so people are becoming infected. Some will become sick and come to the hospital. And as we've seen from our shelter in place orders and other things that we've put in place to decrease transmission, it usually takes a couple of weeks before we see the impact of those interventions. And so if those cases continue to rise, we probably won't see an impact for a couple of weeks with the mask wearing.
The 7-day average number of new cases in the St. Louis area has jumped significantly, hitting its highest point since early May. How will these case numbers impact hospitalizations in the future, and what scenario are area hospitals preparing for?
Well, certainly anytime you have increased cases in the community, that really reflects that there's increased transmission. And from the numbers that we've been looking at, it is concerning. And so anytime you see increased number of cases, increased transmission, the result is going to be eventually you're going to see an increase in hospitalizations. So the key is then to keep that as low as we can. Now we're able to handle the COVID patients that we have right now. We've certainly handled much more, as everybody has seen earlier in the spring. But really, we don't want to get back up to that level. So hospitals have learned a lot since the beginning of this pandemic on how to treat patients and how to organize the care, how to properly protect employees and staff and other patients. And so I feel like the healthcare systems are well prepared to deal with an increase in COVID patients. But really the key is to not get there, to not need to do those things. And that's why we need to be doing some of these simple and effective measures like mask wearing and social distancing and hand washing.
That concludes the list of questions we've received from members of the media today prior to our briefing. Thank you for tuning in.